old women sustain a Holstein-Lewis fracture, which nerve is as greatest risk. So, a 20 years old woman sustain a Holstein-Lewis fracture, which nerve is greater risk. So, first of all, we have to know about the Holstein-Lewis classification. Then it will be very easy for us to identify the nerve which may be damaged or which may be risk in this fracture. Here the options are ulnar nerve, radial nerve, median nerve, musculocutaneous nerve and axillary nerve. So let's see, this is the Holstein-Lewis fracture. In case of the Holstein-Lewis fracture, it is the fracture of the distal third of the humerus. So in humerus there is the distal part. So distal one third of the humerus is there any fracture, this is called the Holstein-Lewis fracture, and there the resulting impairment of the radial nerve. So there is chance of development of the radial nerve entrapment. Here we can see this is the fracture of the distal one third of the humerus, and here one nerve is entrapped in the fracture. In this picture we can see the different nerve present in different part of the humerus. First of all, in the proximal third there is a nerve which is the axillary nerve. So in case of the fracture in the proximal part of the humerus or in the surgical neck of the humerus, there is axillary nerve is damaging option. Then another one which is the ulnar nerve, and this ulnar nerve it going through the medial epicondyle. So when there is fracture of the medial epicondyle or there is insult to medial epicondyle, there are also chance of damage to ulnar nerve or injury to the ulnar nerve. And the third one which is the radial nerve. Here you can see this one is the radial nerve. The radial nerve going all part of the humerus with bony contact, and here we can see in the distal part it may be damage this radial nerve. Also there is another nerve which is the median nerve also present in the distal part. So Holstein-Lewis fracture in details, it is the fracture of the distal third of the humerus, and it occurs due to entrapment of the radial nerve. Radial nerve is one of the major nerve of the upper limb, and in the extensor compartment of the arm, extensor compartment of the forearm, and extensor compartment of the hand. So the wall extensor part of the upper limb, they are supplied by the radial nerve, and sometimes it may be due to reduction, the function again normal. And sometimes when there is associated vascular injury in this condition, there requires open surgery. So in case of Holstein-Lewis fracture which nerve may be damaged or entrapped, it is the radial nerve. Thank you all.